Thanks for joining us. My name is Reba Rice. I'm the CEO of NorthLakes Community Clinic. I'm here to host what will be a series of conversations around the current status of COVID-19, the treatment options available in northern Wisconsin, the upcoming COVID-19 vaccine, and some of the questions around its safety. There's a lot of information nationally about what's happening right now, and we recognize that information can be confusing and overwhelming. So we're hoping that with a couple of conversations from folks on the front line, we can get some clarity around what's really going on right here in northern Wisconsin right now. Today's focus is on the current status of COVID-19 in our communities and what we can do as community members to combat COVID-19. I've invited some folks from the front lines today, and at this time, I'd like them to introduce themselves. Let's start with you, Dr. Dreyer.
I'm Dr. Dreyer. I'm a family medicine physician with NorthLakes Community Clinic. I work out of our clinics both in Iron River and Ashland. I also am the Chief Medical Officer for NorthLakes.
And Dr. White?
I'm Dr. John White. I'm the Director of Emergency Medical Services at Memorial Medical Center in Ashland, Wisconsin.
And Dr. Reitz?
I'm Ann Reitz, family medicine. I am a family medicine doctor at the Red Cliff Community Health Center and the medical director there.
Thank you so much. So my first question is for Dr. White. How is COVID-19 impacting emergency rooms and how you treat patients?
Well, I think there's several different ways that it's impacted us locally and without a doubt nationwide. I think first is just the physical access to the emergency department itself and to the hospital. As anybody that's come to the hospital in the last 9 or 10 months, is you have to go through a screening process and then what we call a sorting process to determine, what's the best spot for you to be based on your symptoms for the emergency department. So that's, I think, a big change for people. There still is a triage process, but the main focus right now is to try to separate out those people that may or do have COVID-19 from those who don't. And our emergency department, we've been fortunate enough to be able to physically divide the department into areas that have no or minimal chance of COVID exposure to that area that is designated for COVID patients that we know have infection or are highly likely to have infection. I think the second important area for our community, or important aspect for our community, is visitors in the emergency department, which is obviously a stressful time when you're going to the department, is you usually like to have someone with you for support, and that has changed based on exposure. Those folks that are deemed to be positive or likely positive for COVID-19 are at this point not allowed visitors unless they are a so-called vulnerable adult or a child less than 18. So that's a big change as well for us and for the community to be able to, or not be able to, be with your loved one when you're in that situation. And probably the third area that has been impacted is difficulties with access to tertiary care. Meaning those patients that require a higher level of care than we can provide locally. It's gotten a lot more difficult to place people in appropriate hospitals nearby. For instance, typically we use the hospitals in Duluth for placement and rarely have troubles with access to beds there. But over the last several months, it's not uncommon at all to have to send people to Eau Claire, Rochester, Minnesota, Wausau, which is a long, long way to go for the patient when they're in a potentially unstable condition, and also for their family to travel.
Great. Thank you, Dr. White. I'd like to follow up with that by hearing what's happening in our area clinics. Let's start with you, Dr. Dreyer.
Similar to what Dr. White alluded to, the local clinics are all doing screening processes both at the phone, over the phone prior to coming in for appointments, as well as when patients present to the door. Many of us have front doors that are locked initially, that you have to be buzzed in. We ask a series of screening questions and we take temperatures at the door. I think the biggest change that we've seen with COVID in general is our ability to offer virtual visits. So the clinics are not just doing in-person visits that has been typical for us for many, many years, but many of us transitioned to doing many of our visits virtually, or as many visits as we can virtually around March of this year. That has various success in our areas just because of some of the limitations that we have as far as being a rural area. But we have seen great results with that. The other thing that we've been seeing is sometimes because of concern with exposure to the virus or the possibility of exposure to our virus, some of our higher risk patients are opting to not come in for visits, which has been very concerning for us. We try to provide them with a safe environment as we can. In an ideal world, I think we would all have access to cell phones with great reception everywhere in our rural communities, as well as high-speed internet and computers. Unfortunately, that's not always the case. And so that's been a challenge for us to continue to provide quality services to these patients who really can't or don't want to leave their house because they're trying to be as safe as possible.
So speaking of safety, what would you all recommend that folks do to keep themselves safe? And Dr. White, let's start with you.
Well, certainly the recommendations from the very beginning haven't changed. The best thing we can do to keep ourselves safe is to wear a mask at all times when out in public, wash our hands with antiseptic on a recurrent basis with any contacts, maintain a safe distancing in social situations, and avoid large group gatherings. That preventive advice has not changed at all since the beginning. And I think certainly there's fatigue around that advice and putting that advice into practice, but that's still the best that we have.
This is a question for all three of you. Based on what you're seeing, how concerned are you about community members having access to care? And is there anything you would recommend to make sure that they have access to care? Let's start with you, Dr. Reitz.
Well, first of all, I just wanted to mention that in our clinic, we have made efforts to modify how we see patients so that patients can continue to have access to care for everything that is that they were dealing with even before COVID. So our clinic is split into two sections. There's a respiratory section where patients with any infection symptoms would be seen, and then there's a separate area. They use separate entrance, and we have designated clinicians to see respiratory patients, so that our chronic patients, we want to really encourage them to continue to come in for the things that they still need care for, their chronic medical conditions, their chronic medicines, and health care and preventive health measures. So we feel that we have made that safe for them, but we want to make sure patients understand how important it is to continue accessing their usual care. And we can do virtual visits if they feel more comfortable with it, or if it doesn't seem necessary to see them in person for at that particular time. And we are very worried about access to care for our patients on a hospital basis and in the ER, and understand that the resources at this time are being challenged, and that we, as a community, as the community of health, as our clinic and the patients, need to do everything we can to try to reduce the chance of spread of COVID infection, to try to take the pressure off the hospital-based system, and as well to take the pressure off of our rural EMS system, which is all volunteer, and it's been extremely challenged by the increase in volume of patients. So that would be, I guess, the other really important thing too is, well, that's all I have to say about access to care.
Great, thank you. How about you, Dr. Deb?
I think the important thing to note is physicians in the area are ready and willing to see patients. And we have multiple modalities of doing that, as we alluded to before, both in person and virtual. What I see is one of the barriers to access at this point, like I alluded to earlier, it's the access to high-speed internet, to reliable cell phone service so that patients can actually access these virtual visits as an option. The other thing I get concerned about is patients delaying care, mostly for preventative services such as their mammograms, their pap smears, their colon cancer screenings and immunizations. These are really important things for prevention and to keep people healthy. And I know because of the concerns with COVID, many people are trying to delay these services. And yet at the same time, it's really important to get your basic medical needs and get these screenings in a timely fashion. So I really would encourage everyone to reach out to their primary care physician and figure out a way that they feel comfortable with accessing care.
Right. And Dr. White, you're seeing sometimes folks who have maybe waited too long, right, in the emergency room. What would you say about that?
Yeah, I think that the two areas that I identify as concerns would be those people delaying their care for fear of being exposed to COVID. And, hopefully we have, done a good job in terms of separating off the emergency department to minimize that risk. But certainly seen various infections and heart problems that people have actually delayed because they were fearful of contracting the infection. And all we can do is reassure them that we're taking all measures necessary to reduce that risk. I think the other area that has been evident is the increase in substance use, alcoholism, depression, and suicide over the last several months. There's no doubt that the stress of this pandemic is having secondary effects on the mental health of our community. And resources have always been limited everywhere for mental health, but now they're stretched even further. So that's an ongoing concern that I have.
Right. So Dr. White shared with us the fact that the recommendations have not changed across the board, right? Wearing masks and using social distancing, hand hygiene. But what are some other things that you would recommend, maybe Dr. Deb and Dr. Ann, about how folks can keep themselves safe in this time? In particular, keeping in mind the things that Dr. White just talked about, that there are not just the things like we might contract COVID, but there are other dangers. So what are some things that you would recommend to folks to keep themselves safe on a variety of levels at this time? Dr. Deb, let's start with you.
I think Dr. White hit on a lot of really key things. This has been a very stressful time, not only for our healthcare community, but just for our communities in general. We definitely do see an increase in depression and anxiety symptoms. We see an increase in drug use and overdoses. I think the key thing is to recognize that your healthcare community is there for you. We do have some resources, we can help. I think the other aspect is remembering to do those things that we typically enjoy and find value in. I think one of the interesting things about COVID is it has allowed a lot of us to become really reflective on our priorities and what's important to us in our personal lives. And so I think the thing I would encourage people to do is grab onto those things that we enjoy doing that bring value to us, and somewhat be creative. We know that you can't spend the holidays with your family in enclosed spaces with large groups, but you can get creative about it. Maybe do a bonfire with s'mores instead of your normal Christmas dinner. I think this gives you an opportunity to really reflect on what's important and values, and kind of start to figure out ways of being grateful and cherishing those things.
Wonderful. Thank you. Dr. Ann, how about from your perspective?
And I think I would emphasize the same things. Our clinic is here. There are people who can who are available every day to address acute mental health issues and distress, and that system is still in place. And in fact, you know, most of us have increased the access to those services. I mean, our staff have made those efforts to make their services more available, more easily available, and using multiple modalities to get a hold of patients, and even doing some group visits, and continuing to really make sure that the chemical dependency services are functioning, and that people are being reached out to. And then just always, it is true that we need human contact, and it is just amazing how safe it is to spend time outside with people if you just take simple precautions. And even though it's going to be, you know, it's a different time of year, we all know how to bundle up and still be able to keep in contact. And then reaching out to the vulnerable people in your family. We've been recommending that a lot, that younger people take somebody under their wing to keep in touch with and do their shopping for them, and drop things off that they need to avoid having to go to the store, and then giving caregivers breaks, all of those things. So anyway, but it is going to be a tough time for people, and acknowledging that.
Right. Well, thank you all so much. We are going to continue this conversation tomorrow with a deeper dive into treatment options and how you as an individual can advocate for yourself and your loved ones. So thanks again, folks, and we'll carry on tomorrow.